Hypnotherapy is an alternative therapy that can help heal a multitude of health problems, including cancer pain, burn pain, fibromyalgia pain, gastrointestinal disorders, asthma, obesity, post-traumatic stress disorder, anxiety, and addictive behaviors, including smoking, among others. While hypnotherapy is very valuable, it should be used in conjunction with other therapies to be most effective. Hypnotherapy works best when it is tailored to the needs of the patient undergoing treatment. There is debate about the effectiveness of hypnotherapy, but studies have shown that it can work, especially for those whose susceptibility to hypnosis is high. Smoking is an addictive behavior that can potentially be stopped with the aid of hypnotherapy. Nicotine addiction associated with smoking cigarettes is a health problem that has continued to decline over the years as education and information about its detriments increases. There are still plenty of smokers that cannot break the habit, though. I have been able to abstain from other addictive behaviors through the help of a 12-step program, but smoking remains a problem for me that I can't seem to beat. I know from personal experience that it is as hard as any addiction to overcome. Smoking only hurts those who do it, yet I continue to destroy my lungs and shell out money for something that will kill me. Many people have experience with using hypnotherapy for smoking cessation, and many studies have come out over the years showing it to be helpful. In their article summarizing many studies that have been conducted, Lynn, Green, Accardi, and Clear discussed the efficacy of hypnotherapy for smoking cessation in an article in the American Journal of Clinical Hypnosis. Hypnotherapy can indeed help those wishing to quit smoking. Though it is difficult to ascertain how useful hypnotherapy is for smoking cessation, some studies are more reliable because they do not rely on anecdotal evidence. Anecdotal evidence has led to inflated success rates and is not a realistic way to determine how well hypnotherapy works. Also, in many studies, it was difficult to know exactly what kind of hypnosis patients underwent. There are still other complications associated with analyzing these studies, and it is hard to say whether hypnotherapy can be shown to have a greater effect than a number of other smoking cessation methods, such as gum, the patch, or psychoactive drugs like Chantix. We can learn a lot from the analysis of these studies, though, and it seems that hypnotherapy can definitely help. More sessions, more follow-up with the hypnotherapist, and individualized versus standardized hypnosis contribute to hypnotherapy being more effective. If hypnotherapy is conducted in an effective way, it can be very useful. Many people do not believe hypnosis is viable and may see it as a fraud. Such people would probably not be good candidates for hypnotherapy. Level of susceptibility is something that will affect a patient's success. It is actually a very important component of hypnotherapy. If one is not open to the possibility of hypnotherapy, or anything for that matter, then the chance of it working goes down considerably. It is possible that a placebo effect takes place with hypnosis, but other forms of smoking cessation may have this effect as well. In most smoking cessation products, just introduce more nicotine to the body. So why wouldn't someone wishing to quit smoking try hypnotherapy, a natural alternative to combat addiction instead? Most of the studies Lynn Green, Accardi, and Clear report on either support hypnotherapy or give it better marks than these other methods. It does not seem as if the debate on hypnotherapy to quit smoking is if it works, but if it does the job better than other methods. I, for one, now feel as if hypnosis for addiction is something I want to experiment with, as nothing else has worked thus far. The conclusions Lynn, Green, Accardi, and Clear have come to are in line with what I thought about hypnotherapy for smoking cessation. If a patient is susceptible to hypnosis, then it can be a tool that can aid in quitting. I believe that it has the potential to be very effective if used on the right patient. In their own study, Lynn, Green, Accardi, and Clear achieved a 6-month 35% success rate, further solidifying their claim that hypnotherapy is a smoking cessation method that should continue to be examined and employed. I do not know how susceptible I am to hypnosis, but if I am at all, I will give it a shot. So far, nothing else has worked, and I would rather try hypnosis than put more nicotine in my body with gum or the patch, or take Chantix, which has shown to have negative side effects. Nowadays, I am more willing than I used to be to try an approach such as hypnotherapy.